Okay. Should have told me. We can edit that out.
Good evening, everyone. My name is Michelle Marcel, and I'm president of the League of Women Voters, and on behalf of the League of Women Voters called Glen, Ellyn, and my co-president, I would like to welcome you all here this evening. We are happy to have all of you joining us in person, and so many of you, I guess, online. Right? Okay. So the purpose of the League of Women Voters is to promote political responsibility through informed and active participation in government. The League works to increase understanding of major public policy issues and influences public policy through education and advocacy. The League does not support or oppose any political party or any candidate. And so this evening we have our VP of Programs, Bernie Lajenski. I said that wrong, but to tell us about our program. Thank you, Michelle. All right, thanks, Michelle. You did a good job of that. It's Lajenski.
Well, good evening and welcome to today's program. As the title indicates, we're here to discuss mental health in Milton Township and get an update on the Milton Township 708 Community Mental Health Board. We are grateful to our 6 panelists who are joining us this evening to discuss the topic which is important to our community. So just a few housekeeping things. This program is being recorded. So we are recording the program and we'll post a recording of this on our website for future viewing. There will be some Q&As, so for folks who are joining us on Zoom. If you would like to ask a question, you can click on the Q&A button on the bottom of your screen and type in your questions at any time. Howard Daly, our VP of Communications, will present your questions to the panelists. For folks here in person, you can hold on to your questions until the Q&A session. All right, and we'll try to get to as many questions as time allows. A little bit of background and some context for our program tonight. You may or may not know that the League of Women Voters have been in existence for a long time, for over 100 years. And we have a long history of studying issues and formulating positions. Based on established positions, the League takes action on a broad range of issues, such things as violence prevention, pollution control, and mental health. Both the U.S. League and our Illinois State League have long held positions on mental health. As you're going to see in these 2 slides, you can take a look. This is the U.S. League's position. I'll point out a few of the highlights that I'd like to talk about. First of all, tonight you may hear the terms mental health and behavioral health used interchangeably. The League supports the use of behavioral health, which includes both mental illness and substance use disorder. Also, the U.S. League, one of the highlights I'd like you to take a look at, it states that all people should have access to affordable, quality behavioral health care that achieves parity with physical health care. See, the next slide is the Illinois State League position on behavioral health. And this position dates back to the late 1980s. So a few things here. The League supports a comprehensive, coordinated system of services for behavioral health and supports a system of local boards that administers funds for services. The League believes the board should have the power to tax and to allocate funds for community services. And we believe community education about mental illness should be emphasized. So the League stands firm on long health positions when we promote community education on behavioral health, and when we advocate for and when we monitor community mental health boards. For additional context, let's hear what a local mother and Volunteer with NAMI, the National Alliance on Mental Illness, has to say about the purpose, need, and value of community mental health.
NAMI. I volunteer for my local NAMI, and I am the mother of a son who was diagnosed with schizophrenia. Growing up, my son was witty, charming, and smart. He got a perfect score, math score, on his college ACT. He went to University of Illinois for engineering. However, during his senior year of high school, we noticed some changes in him. We found out he was smoking marijuana, he was getting high all the time. After his first year of college, he flunked out. His behavior was becoming more erratic. He told me he thought people could read his thoughts. It took a long time for him to be diagnosed with schizophrenia. And then for a while, everything was better. But like so many other people, he stopped taking medication. He was never really the same again. My son died 6 years ago. Schizophrenia didn't kill him, but it put him in the time and place that did. It changed my life. It changed my family's life. I retired early so that I could advocate for mental health. I am asking you today to vote yes this fall on the referendum to create a 708 community mental health board. Community mental health boards can help fill the gaps in programs and reduce the long wait lists. Our community needs this. Please vote yes.
Well, we are grateful to Lori Glen for sharing her family's experience with mental illness. We know there are many, many more families now living similar experiences, facing painfully long waits to access help and falling through gaps in behavioral health programs. Here in Milton Township, in April 2021, voters did vote. Voters approved a referendum that established our township 708 community mental health board to fund programs for mental health, developmental disabilities, and substance use. And that brings us to why we're here today. Let's move on to the panel presentations and hear about the 708 board and mental health services in Milton Township. Here to introduce our panelists and to moderate this evening's discussion is past Ellyn co-president, current lead board member, and dedicated mental health advocate, Erica Mills. Erica. I have seen that video probably 15 times, but it always stops me. And Lori made that video along with some others to really advocate for exactly what we're talking about tonight, and it's the value of an established, well-organized program like we have in Milton Township. We are so grateful for people here. I want to point out a couple of folks, and one who is a particularly close friend of mine, Mike Murray. I think if you could wave and say hello. Mike is one of those people that when you make eye contact with him, you end up doing exactly what you want to do. And so while I have always been an advocate and supporter of mental health, especially student mental well-being, when I served on the school board here in District 41, both Daly and I were members of the coordinating committee to help pass the April 2021 referendum. And it was under Mike's tutelage that we did that work because he advocated and helped to pass the first DuPage County Community Mental Health Board in Bloomingdale Township. And so that was our kind of focus. And now we have Milton. Here tonight, we have two trustees from Milton Township, Jeff Castle and Dan Malenko. Thank you for being here. And I also want to welcome a new 708 Community Mental Health Board trustee from Lyle Township, newly passed just when was that? In November. Yash Yamanaka. Coach told me that they had their first board meeting last night, and it's just beginning. So welcome. Thank you for being here. Tonight, 4 of our panelists actually represent 3 agencies which received 708 grants this year. I will let them introduce themselves individually. First, we have, thank you, Rob Wilkinson, CEO of the B.R. Bridal YMCA. We have Clark Johnson, who is the Executive Director of the Glen Youth and Family Counseling Services. Next to her is Jessica Gull, Program Coordinator and for outreach for the Glen Ellyn Youth and Family Counseling Service. And Teresa Kornhofer, who's the CEO of Easter Seals of DuPage and the Fox Valley. Rob, I'm going to have you introduce yourself first, and we're going to go through our agencies. Then we're going to come to Kara Murphy and Shannon Hartness, who will kick off our program with their introductions and their message. So Rob, if you could start.
Great. Thank you, Erica, and thank you to the League of Women Voters for having me here tonight. Just a little background on myself. I think we're going to do our program descriptions after, but I'm the CEO of the BRL YMCA. I've been the CEO for about 4.5 years now, but I've been a leader in YMCA's both here in Illinois and Florida for over 34 years, and definitely realize the importance of not only mental health, but having kids feel a sense of belonging in the programs that they're in. So appreciate the opportunity to share what we're doing tonight.
Thank you, Rob. Clark, I'll have you go next, and then Jessica.
Hi, everyone. I'm Clark Johnson. I am the new executive director with Glen Ellyn Youth and Family Counseling Service. Prior to this, I was in private practice, and I have experience with community mental health in a different township, as well as working in the healthcare hospitalization system for Ellyn Oaks. I work for them. I don't know if you're familiar. I've also worked for our employee assistance program, connecting people services through that. So I'm super excited to be here to be able to provide services to those who need it the most.
Hi, everyone. My name is Jessica Gold. I am the outreach program coordinator at Glen Ellyn Youth and Family Counseling Service. A little bit about my background. I'm currently a graduate student at Florida University, getting a master's degree in social work with an MBA. And I started off here as a clinical intern. I was primarily doing clinical work in addition to doing some outreach work at the Glen Ellyn Public Library. I started this role as outreach program coordinator back in August. And at this point, I'm offering services to library patrons that include resources and just information that's in the community of DuPage County. I'm very excited to be working along with Clark at GYSS.
Thank you both. Teresa.
Hi, I'm Teresa Forthover, President and CEO at Easter Seals DuPage and Fox Valley. I've been there for about 12 years now, which is hard to believe. While my background has been professionally in nonprofit management pretty much my whole career, I'm also the parent of three children. My daughter hates it when I forget them. Three children, two of which have myotonic muscular dystrophy and autism. So I bring kind of both my mom hat and my professional hat to my job. And I think it helps me when we're having to make difficult business decisions to understand the parent perspective and the impact it has on families. For those of you who don't know, Easter Seals is a facility for outpatient med rehab for children with disabilities and developmental delays. And we have a large program now, thanks to funding support from Milton Township and others, providing mental health and behavioral health support to children and their families.
Thank you, Teresa. I'm going to have Kara and then Shannon introduce themselves, and then actually Shannon, I think you're kicking off our program, and then Kara, and then I'll go through by introduction the rest of you so that you'll hear more about, again, the grants that these three agencies will represent, a little bit more of what they're doing with that money so we can access to that and the value of that. So Kara, let's go ahead and have you introduce yourself, and then Shannon, you can start the program.
Sure. Hi, everybody. I don't know if I need that. My name is Kara Murphy. My day job is as the president of the DuPage Health Coalition, which coordinates health access for low-income, uninsured, and underinsured residents of all of DuPage County, including Milton Township. I'm a Milton Township resident. One of the things you'll learn is that all of the work that comprises the community mental health board is comprised of township residents living in Glen Ellyn. And in addition to being very, very proud and pleased to sit on the community mental health board and the care of the secretary, I also co-chair a global collaborative called Impact Engaged, which is intended to support collective impact across our communities, as well as co-chairing an organization called HEART, which is the Health Equity and Access Response, and also focused on understanding the pervasive inequities that exist in our community and every community, and looking for meaningful ways to address those. Happy to be here.
Good evening, everybody. My name is Shannon Hartnett. My day job is the executive director of Northeast Age Family and Youth Services. We're a community-based mental health organization. We're based up in Addison, but we serve all of DuPage County. My volunteer role here, and I have the honor and privilege of being the president of the Milton Township Mental Health Board. And so I'm thankful to many of you in the room who were really pivotal in getting this mental health board up and running. And so it's been fun, it's been rewarding, and it's been exciting to see what some of these agencies are going to be able to do with the funds that we're able to give. So really happy to be here and excited that you all are here to hear more about what we've done and what we're planning to do. So thank you.
Thank you both very much for being here and for your service, all that volunteer time that you're giving us in the township. So we're going to start with Shannon and then Kara, and after that, we'll just move right down the row. Each of our presentations will be, at least this first one, about 15, 20 minutes, and then subsequently about 10 minutes for each. We want to make sure we leave some time. Please, if you have a question, jot it down for yourself. We'll give plenty of time to provide some input. And then Karen will be looking for questions through our Zoom partners as well, and we'll make sure we leave some time for that. So Shannon, I'll let you take it off.
All right, so as I said, Karen and I are going to tell you a little bit about the Milton Township 708 board, why it's called the 708 board, if you don't know that, and review with you what we've accomplished in the very short time we've been established and what we have on deck for the coming year. So what is the 708 board? Why do we call it a 708 board? Community mental health boards, also known as 708 boards, are really kind of named after House Bill 708. We were first established in 1963 in the Illinois state statute. So going back a long way. To establish a community mental health board, as you know, you have to have a passage of a referendum, which we had back in April of 2021. And then you have a tax levy that's appropriated to the 708 board to distribute in terms of funding awards, which we'll talk more about in a minute. The other, the main purpose is really to plan and fund services that address mental health, intellectual and developmental disabilities, and substance use services. Those are really the kind of three areas that we're working in. Illinois has over 90 708 boards, and DuPage County just passed several other new boards, which is really, really exciting. A couple others in suburban Cook, maybe. And if you want the running list, Mike Murray. But it's really exciting. We're the second, the Milton Township Mental Health Board is the second 708 board in DuPage County, followed by Bloomingdale Township. So we've learned a lot from other 708 boards. We were not shy about reaching out to them and asking them how they did things and to give us documents if they could do that. Many were generous and met with us in person over Zoom, and so it was a really nice way to collaborate and get to know some of those other 708 boards too. And so we're trying to return the favor now. We're getting asked by some of the new boards that have questions, and we'll share whatever wisdom that we have. So that's been really exciting. A little bit about our history again. The referendum passed in spring of 2021. Our board was appointed by Supervisor John Menino very quickly after that in June of 2021. And we had our first meeting in August of 2021. So we really wasted no time in getting going. You'll see up there, it's a 7-member board, again, all volunteer, all Milton Township residents. I live in Wheaton. Kara mentioned that she lives in Glen. So we're all invested in the community in one way, shape, or form. We have some guiding principles that we as a board established right off the bat. 5 of them. One is to increase coordination and collaboration. DuPage County has a lot of resources, and we want to make sure that the ones that are within Milton Township are coordinating with each other, collaborating with each other as needed, to really make sure that we're the most efficient and most effective with those resources. Again, so many resources, and there's expertise that a lot of these agencies have, and so we want to make sure that there's warm handoffs and that folks know each other. And can refer to each other if their clients are in need of something that they don't necessarily provide, but they know someone who will. So really it's about increasing coordination and collaboration. The other thing that our mission is to increase public awareness. Things like what we're doing here tonight, making sure that people know about what the community needs are and what the resources are and where the gaps are. And why something like a community mental health board is really important to be able to fill those gaps that the state doesn't provide for, that the federal government doesn't provide for. And so making sure that we have all that information and be able to give that to all of you. With that, again, looking at the ongoing needs. We're lucky in that Kara mentioned she's the co-chair of Impact DuPage, and if you're not familiar with Impact DuPage, it's amazing if you just go to impactdupage.org.
Absolutely.
Okay. Whatever question you have about data in DuPage County, it will answer that for you. And so we were lucky enough to, when we were conducting our needs assessment, right off the bat, to have Kara's expertise.
Know how to navigate a website.
In-house expert on that. And so the point is, we really didn't have to go far to acquire really, really good data and tell us what's happening in our communities. From the zip code level to the countywide level. DuPage County does a really, really good job at that. So it's right here. A lot of the information that we need. So we're able to really point you to that resource and others as we move through this process. The other guiding principle, of course, is to spend tax dollars responsibly, right? So these are the people's dollars, it's tax money. We want to make sure that it's spent appropriately. Again, being efficient and effective with those resources, making sure that we're using them wisely. So that's a really important key piece that we're paying very close attention to, obviously. And the fifth thing is really to monitor and report impact. It's important to be able to measure the effectiveness of what you're doing, not just to do it just because we've always done it, but to really know that it's making a difference. And so in that regard, you know, we've asked the grantees to provide us with some data and some information to really show that impact. And so that we can report that impact back to the community. Who is essentially funding these services. We want to make sure that you all know that we're spending the dollars wisely and that they're being used wisely and that they're making a difference in people's lives. Just to give you an idea of our operations, we have regular meetings on the 4th Tuesday of the month. This year, we had a meeting in February, and then we meet again in June, September, and November. And then we have special meetings. We reserve the 4th Tuesday of the month for special meetings. We have our next special meeting on April 25th. We'll be at that meeting, I think, approving the funding application for next year. That's at least our intent. All of those meetings are listed on the Milton Township website. The website has been refurbished and it's fantastic. Easy to find. There's a tab right at the top, Community Mental Health Board. You click on it, it'll give you all, you know, the information that you need about the meetings, the agendas, previous meeting minutes, all of that is there. And we meet at 6:30 at Milton Township, there on Main Street in Ellyn. To give you a sense of our budget, and then I'm going to turn it over to Kara, and she's going to talk about specifically what we were able to do with some of the funds. The tax levy this past year, 2022-23, was set at $800,000. We collected a little bit more than that. This coming year, we're expecting a tax levy of about almost $850,000. So that'll give us a little bit more room. And again, these are numbers that are on file with the DuPage County Clerk. So it's readily accessible. And this previous year, we were able to allocate 700,000 of that 800,000 to funding awards, which is really, really good. And so we're expecting next year to increase that amount. And so Carol will talk about that in her part. So I will turn it over to her. Just forward.
So I'm not gonna spend a ton of time talking about organizations that are here, because I think it'd be much more effective for you guys to hear from them yourselves. But as Shannon shared, referendum passed in April of 21, but we first received funds that we can use toward awards in May of 22. So there's about a 1-year process before those dollars actually come in, as to the setting of the levy and the collecting of the property taxes, et cetera. And so we received our first influx of funds in May of 22. Our application opened in July of 22. We accepted applications through the summer, made awards in the fall, and completed the contracts in December to begin effectively in January. So all of our funded agencies are in close ending their 3rd month of funding. And so, as you might expect, a portion of our process is to get mid-year reports, see how they're going, whether there are any changes or differences from what they anticipated, so we can make adjustments. And then, of course, we have end of year reporting, which will actually come after the 2nd round of funding. So folks may be applying for funds for next year before they have fully reported, but they will have provided us interim reports in that meantime. So since funding can be used for both behavioral health, including both mental health and substance use disorder, as well as services for individuals with disabilities, we look at the funding that we awarded across those categories. And just there, I'm not gonna try to look at that, but hopefully you can. Our initial plan was that we provide no more than 3 awards with $100,000 maximum, and that most of our funding would go in smaller awards that were not going to exceed 50,000. But ultimately, we made our decisions based on the strength of the applications. And so those applications that came to us that were asking for more money, but also showed promise for showing real impact, were the ones that we ultimately funded. People were able to ask for whatever they wished, and we were able to determine what funding allocation was available from us. And so in some cases, there were requests for funding that we ultimately reduced, but covered in a portable amount. A total of 22 applications in the first year. So some of the funding partners, the largest bulk of our funding went to mental health, and we distinguish in this slide deck between mental health and substance use disorder, but of course, oftentimes those are co-occurring. But we funded projects with YWCA and Outreach, both at $100,000 each. The Outreach project was focused on case management and counseling services, and the YWCA program on early childhood mental health supports. Similarly, we also provided funding support to Glen School District 41 and Consolidated School District 89, as well as the RI when I put these together because they share some elements in common. In some cases, it was focused on before and after school behavioral health support, and also social work and counseling support for children in schools, working in collaboration between school districts and behavioral health partners. I'm going to let Glen Youth and Family Services talk about their project and also the RI will develop some more about theirs. But we also provided some smaller funding awards for other mental health services, including SMARE Care Counseling, which is actually a grant that's supporting psychiatric services, which are commonly not available, as well as Teen Parent Connection, supporting an intern-based community mental health program, Immigrant Solidarity Page, providing behavioral health services in Spanish as well as peer counseling services, and Evangelical Child and Family also providing counseling. Sorry. Everybody was fine. We also provided funding for substance use services to Pathway to Recovery Foundation, and this is actually a peer support model with individuals with lived experience of substance use disorder, walking hand in hand with individuals in recovery, helping them to rebuild the lives that they're trying to create. We also provide funding to a number of organizations that really have a blended or integrated model of care that blends behavioral health, and in some cases, services for individuals with disabilities. NAMI DuPage applied to us for funding for the Ending the Silence program, which provides education to middle school and high school students, thousands and thousands of middle school and high school students across our community to help them be aware of, sensitive to both their own behavioral health and the behavioral health of their friends and family. Easter seals, I'm gonna let Teresa talk a little bit about, and the DuPage Federation, we provided support for interpreter services for counseling, so that for individuals, like for example, the Ukrainian refugees that are currently coming to our area, who need behavioral health, but don't have a Ukrainian provider, can still receive those services with interpretation. Finally, we provided services for individuals with developmental and intellectual disabilities. In addition to the services that Teresa is going to talk about, we provided funding to Ray Graham and UCP Segwit services, both for community integrated living and supported living, and also for work supports, allowing individuals to work to their full potential. As Shannon mentioned, we anticipated funding awards and actually made funding awards of about $700,000 in the first year. $71,000 was spent on staff and administration. That's really important to us. We have one part-time staff person. We have a grants management tool. Thank you. I don't mean slides clearly. Actually, one of the things that we're really excited about is that if you look at year FY23 versus FY24, you'll actually see that our staffing and administrative costs are going down. So we're going to have more money to be able to provide to the awards and to the awardees. If anybody has questions about the township, and let us say that our favorite person in the world is Jennifer Hutchins, the manager of our community mental health board. She's wonderful. She's a resource, and she makes what was much more challenging in year one feel easy because she's so capable and confident. What comes next? Our funding cycle is opening in July of 2023. We will have $750,000 in awards. Again, we anticipate that we'll have a certain number of awards that are at that $100,000 level, and that the remainder will be distributed to other projects. We'll be intentional this year, I think, about reaching out, especially to our substance use disorder partners, because we know that there are significant needs, and we think that there's probably an opportunity for us to provide more support there. We simply didn't have the applications to provide awards for year one. But always, and it's important to know this, 100% of the award will be used to support Milton Township residents. And that's something we take very, very seriously. I'm going to hold for questions.
My turn?
Yes, please.
We did have a request online to make sure that you speak into the microphone so that they can hear it there. Thank you.
Okay, as I introduced myself earlier, I'm Teresa, I'm the president and CEO of Easter Seals, DuPage and Fox Valley, sorry. And one of the things I want to do before I start my presentation is explain just briefly how the Easter Seals national organization plays into the affiliate. I think one of the things that most people assume is that the national organization provides funding and support to the affiliate on the ground. And we're really the boots on the ground, and we pay a fee to the national organization. They don't fund us. You can think of it almost like a franchise. So we get the benefit of working with other Easter Seals affiliates, but we pay a fee to the national organization. They really focus on advocacy, education, and awareness, where the affiliates across the country are the boots on the ground. And if you know one Easter Seals, you know one Easter Seals, because we also do a lot of very different things. At our affiliate, DuPage and Fox Valley, we serve the whole suburban region, which I'll have a slide for in a minute. And we focus almost exclusively on pediatric med rehab. And we also have an inclusive daycare center, which provides daycare services for children with disabilities and without. And we're one of the only ones in the community, really in the state, other than Peoria Easter Seals, that has that type of unique service.
Teresa, we're getting them reset up here.
Oh, okay, thank you. So I'll start with the sharing, and we see about 1,000 children a week at Easter Seals with developmental delays and disabilities. And that can be everything from a mild speech impairment to very medically complex children. We take all kinds of insurance, including Medicaid, and we are also EI providers. What is, I think, commonly misunderstood in the pediatric world is the reimbursement rate from insurance companies is about 80% of what it costs us to provide a service. It's very different than adult rehab. When I had my shoulder done and I saw the bills that came in and how much they were able to charge, I wondered why we couldn't charge that same rate. So this is our service area, and you can see that we have centers in Villa Park, Naperville, and Ellyn, and we are early intervention providers, which means we provide services in the home to children ages 0 to 3. We also provide services to families across 162 communities, from West Suburban Chicago, DuPage, Kane, and Will counties. But what is stated earlier is we are very intentional with 708 board dollars, and those go specifically to our clients we serve in the Milton Township area. And we work with other township 708 boards as well, and we're very intentional about those services. This gives you just a quick breakdown of the types of ages that we see. Again, those 0 to 3 kids is mostly your early intervention. However, to qualify for early intervention, you have to have a 30% developmental delay. And if you think about a child who's 2 years old, a 30% delay is significant. And so there's a lot of children who don't meet the early intervention criteria, but still need support and help. We also work with young adults. And I smile a little bit because we work very closely with Ray Graham as our children become older. And my son actually received vocational training through Ray Graham and has a wonderful job at Texas Roadhouse. So if you ever find yourself in Texas Roadhouse, they're a wonderful supporter of children and adults with disabilities. The average length of therapy stays about 23 months. We have a variety of different diagnoses that we serve. And one of the things that I think is unique about us is these are diagnoses that our therapists are experienced, trained, and provide. It's not just things we can do, they're things we are doing right now. And as I said, it can be very broad, from a mild developmental delay that maybe takes a few sessions to somebody who's very medically complex. Our therapy team is expansive. We have 78 leading clinical therapists, and we're very multidisciplinary focused, so that you really get the full look at the child and the family. And that's really where our mental health services grew. We had less than 2 years ago, we had 2 social workers. We now have 9, including a bilingual psychologist and a case manager. When COVID hit, the need for our families was exponential. Trying to work with children with disabilities on a normal day is challenging enough, but you add e-learning and all the other challenges that families were facing working from home. It was just extensive. When we started with Milton Township, we had 64 kids from Milton Township on our waiting list for mental health services. As of today, we have 7, so we still have kids we need to get to. Even that was immediate. We are also an NDT Center of Excellence, that's neurodevelopmental treatment, and we also provide DIR, which is a format of developmental arrangements for children primarily with autism. We have several therapists that are bilingual. We're CARF accredited. We're one of the only CARF accredited affiliates, rehab services in the entire state of Illinois, with the exception of Peoria, Easter Seals, who has very similar services to ours. They are also CARF accredited. We're an NDTA Center of Excellence, And we're a teaching facility, so we take internships, we do a lot of mentoring and a lot of work with the local colleges. We're internationally recognized. We have staff that teach across the country and across the world. We have a medical advisory board made up of 14 doctors that volunteer their time once a month to hear cases that are more challenging and help parents get additional resources from medical professionals in the area. We are one of the largest and most experienced pediatric rehab centers in the area. We have diagnostic clinics. We have an autism diagnostic clinic. I always hate to say this, we have the shortest waiting list around. And the more I say that, the longer the waiting list gets. But we have families who will come to us because they've been on a waiting list for over 2 years. When you have a child with autism, and I know this personally as well as professionally, the earlier you can help, the more impact you will have long term. We talk a lot about in our field the brain development that happens in those first 5 years of life. Those synapses are growing and changing rapidly. And for every dollar you spend in those first 5 years of life for children with disabilities, you save 24 when they become adults. So the more we can impact those early years of life, the better off these children and families are later in life. And I do know that personally, I have 2 children. One is 30, working at Texas Roadhouse. He was diagnosed when he was 7. My youngest was diagnosed when he was a few weeks old. He had early intervention, he had early services, and he far surpassed his brother, even though he's more significantly challenged. We also have a medical diagnostic clinic in collaboration with the University of Chicago, a developmental pediatrician. Our mental health and family services team, as I already stated, grew significantly. And we do everything from individual group counseling, but this is specifically for families and children with disability, and it's something that's hard to find in other places. We are partners in child development. We work closely with doctors, schools, and hospitals and parents. I always like to share this slide. 98% of our clients are satisfied, 97% made progress towards achieving their goals. That's incredible, and it really is the dedication of our therapists. And then 97% will recommend Mr. Seals to others. One of the things, this slide. One of the things that I really want to share with everybody here, because everybody in this room knows a child, right? Does everybody know a child? Does everybody know a child who's under 10 or under 5, let's say? So if you go online to askmrseals.com, there is a developmental screening tool that you can use for every child. This isn't just if you expect your child has a developmental delay, but for every child. And we encourage every child to take it. It's in English and in Spanish, and we also have a social emotional screening tool as well. They're free, they're online, they're extensive, so it takes some time, but everybody can use it. Grandparents, parents, caregivers, and we share these tools with all the early childhood programs across the geography that we serve. So I encourage you to use that. It's a great tool and a great resource. I'll wrap up. I'm sorry, I hope I'm not making it too long. But the 708 board, I wanted to speak real quickly on how it impacts us directly. As I already talked about the waiting list, we were able to see kids that have been on the waiting list immediately. We focus specifically on Milton Township. I think it's one of the misnomers is even a middle income or upper income family who has a child with disability, insurance deductibles, co-pays are extensive and they're getting worse. The other thing that insurance companies do is they often provide a maximum number of services you can receive in a year. So a child with medical complexities could be limited to 60 services in a year. If you need OT, PT, speech, a medical diagnostic tool, anything like that, you've used those services in 3 months. And then you're left to pay out of pocket the rest of the year. The insurance industry, as I said, covers about 80%. Even the best insurers cover about 80%. We raise the rest through fundraising. It enables us to really focus on those early years while the brain is developing. But one of the things that was also mentioned, the opportunity to collaborate with other social service providers in the Milton Township area, get to really know who does what, where, and do those soft handouts or those warm handoffs from one agency to another. Not all of our families who are on need mental health support or behavioral health support are appropriate for our program. We now know where to send them. And so it's those collaboration things that I think make the township 7 or 8 boards unique from any other funder that we get services from. So thank you, and I appreciate the time.
Okay, I'm Clark Johnson, again, the executive director with Glen, Ellyn Youth and Family Counseling Service. So I'm going to tell you a little bit about us and our history, and then Jessica is going to go over what we're doing now and what we plan to do in the coming year. So Glen, Ellyn Youth and Family Counseling Service, we're a nonprofit agency, and our mission states the primary mission of Glen, Ellyn Youth and Family Counseling Service shall be to promote the mental health and well-being of youth, families, and the larger Glen, Ellyn community through the provision of professional counseling services and community-based support and education. No individual, family, or group shall be denied services based on inability to pay. We are also happy to be partnered with Bridge Communities as well as the Glen Ellyn Police Department. So currently we provide mental health services, so individuals, families, groups. We provide counseling to them at a sliding scale fee. And like I said, in our mission, no one is turned away for inability to pay, which is really nice. There's not a lot of it's really rare for that to happen in the mental health field. Like you mentioned, insurance is really expensive to get this care. So just look a little bit about history and kind of some of the work we've done over the years. So since April 2011, we have received over 300 referrals from Glenbar South High School, over 200 referrals from Glenbar West High School, and over 40 referrals from the Glen Ellyn Police Department. So really the youth and the families and the community. We are strongly partnered with the high schools and school districts in Glen Ellyn to support those families who may have fallen through the cracks in getting what they need. Within the last year, so from May of 2021 to April of 2022, 55% of all of our referrals were received from the 8 Glen Ellyn district schools. 5 to 10% were referrals from Glen Ellyn residents who received our services and referred us to a family or friend. We delivered 987 counseling hours, and we saw over 1,000 clients. 85% of counseling services were provided to individuals, youth, and families with incomes at or below 200% of the federal poverty level. 84% were under the age of 18, and 63% were minority families. So a little bit about our team. So there's me, and then there's Jessica, our outreach program coordinator, and then we have a part-time licensed social worker, Jessica Walters. So we're a small team, but we do a lot of good work. So I'll let Jessica go over what we're doing now and what we're gonna go over, we hope to do within the next year.
Hi, everyone. I'm Jessica Gull, the outreach program coordinator at Glen Ellyn Youth and Family Counseling Service. I'm just gonna go over what we're doing now. So we're currently implementing the Empowering Community Connection Health and Opportunity, or ECHO project. And this is the project that we actually wrote about in the Milton Township 708 grant. Part of this project is targeting mental health concerns through low-cost treatments. As Clark had shared earlier, our mission is to never deny people services based on their inability to pay, and we are truly dedicated toward that in everything we do. We also have the mental health task force. That's a monthly meeting that we hold. And we talk a little bit about the trends and concerns that we're seeing regarding mental health within the community. We're also working on some fundraising efforts and our partnerships with Glen South and Glen West. Currently, I know Clark is at Glen South, seeing some students who present with transportation and financial limitations. So a lot of these students are otherwise unable to come to our agency just for different reasons. So being able to go meet them literally where they are is a great pride of ours. We're currently partnered with Bridge Communities, the transitional housing program, and we work with a lot of the families who are part of that program. Again, providing mental health services to families who might not be able to afford it otherwise. We're working on expanding our partnership with the Glen Public Library. I'm currently there providing outreach to library patrons coming in Tuesdays and Friday. But we would like to grow that a little bit more and see how many people we can help. We're also interested in increasing staff. Clark said it's me, her, and Jessica Walters. And yes, we're a small yet mighty team, but we would love to include some other staff members who would also be willing to see clients and help out as well. And we will be participating in stage giving days. So, a little bit about us.
So as I shared earlier, my name is Rob Wilkinson, the CEO of the VRL YMCA. If you're not aware, the Y has been serving the communities of Glen, Ellyn, and Wheaton since 1919. So over 104 years, the Y has been providing impactful programs to our community. Similar to Easter Seals, our local Y is autonomous. I mean, it's run by a local board of directors. And the reason for that is that every community is different. So what the Glen, Ellyn, and Wheaton communities need may be very vastly different than Evanston or Chicago or other communities in the area. And our board of directors ultimately help set the vision, strategic plan based on what community needs are. Our areas of focus are youth development, healthy living, and social responsibilities. And our mission really is to make sure that our communities, we can make our community a better place. That includes the nurturing of youth in order to make sure that they are set up for success in life. Similar to you've heard from both Easter Seals and Glen Ellyn Youth and Counseling Services that, we also, as part of our mission, is that no one is turned away because of inability to pay. And we do find that in a number of our programs and services, that is a critical component of our mission. You typically think of the YMCA as gym and swim. It's where you send your kids to learn how to play basketball or learn how to swim. And we're so much more than that. And whether it's our senior programs that help provide social interaction and provide seniors with the opportunity to stay independent by staying healthy, or our chronic disease programs that help individuals with not only Parkinson's, Live Strong for cancer survivors, or those with prediabetes in our diabetes prevention program. But one of our largest programs that we have is our child care program. So not only are we licensed for over 100 youth between the ages of 2 and 5, but we also provide before and after school care, not only at our Y facility, but also in districts 41 and district 89 and 6 different schools. So in addition to 100 kids on site for licensed child care, we're serving over 300 kids a day before and after school care, and then close to 400 kids a day during the summer months. And that's really where we have a strong partnership with the school districts that ultimately identify the gap in services. you wouldn't necessarily think of the Y as being in the mental health realm. But when we really looked at, the issues, behavioral issues that we were having with kids in before and after school care, and then also in summer camp, it really led to a discussion with the superintendents and the leadership at both school districts to say, where is there a gap in services? And ultimately, we found that that out of school time, not only before and after school, but also during the summer months, is where there was a huge gap in support and services. A typical social worker that works for the school district is on a 10-month contract. So once summer school ends, there's then a gap of services from the middle of June through the middle of August. And so our request to the township was to look at the school districts and the Y partnering to share a social worker staff person. And the funding that we received from the township provides half of that salary support. And then the partnership between the Y and the schools is picking up that balance. So we have stake in the game to make sure that, hopefully it's a sustainable position. We're not 100% relying on the township to ensure its success. But when we look at, like I said, the number of kids that we're serving on a daily basis, not only in preschool, but then also in those families that need that guidance. But also in the before and after school, we're fortunate that we have a strong working relationship with not only the principals at elementary schools, but our staff have a relationship already established with the school social workers. So our model that we've established is that we have 4 elementary schools in District 89 that we provide before and after school, 2 in District 41, and then the wide site. And the social worker will spend 2 days a week at District 89 schools, a day a week at 41, and then 2 at the Y. And then once the summer school ends, then they'll be at the Y 5 days a week during the summer. The position will be a flex schedule, so typically it'll be a 10 a.m. until 6 p.m. so it can cover the after school period, but it'll be flexible that it could serve before school until the midday. And then same thing during the summer months, it could be early morning until midday or midday through the end of the child's time for summer camp. It's definitely something that we not only think will help support families and kids from preschool through school age, but also be a support system for our staff, because you can imagine before and after school staff, mainly college age students, and they rely on the social workers at the schools, but they're only there for just a very minimal time until they're off and our program starts. So this person will definitely help us provide additional support to staff, but then also work with the teachers and the social workers at the schools to make sure that the proper guidance and support is in place for those kids and families in need. So I appreciate the support of the township. Just to give you an update, so when we got awarded, or when we finished the contract in December, this is a new position. I didn't share that it actually the person will work for the Y, which will then allow us to have it be a 12-month position, not a 10-month, and not a contracted position. We posted the position in January, screened candidates in February, and we actually have interviews next week. So we're tracked to have that person in place, so they'll finish up the school year to build those relationships with the school staff and the school social workers, and be available for the summer programs. So once again, we can't say enough about the support of the township for this position.
I guess I'm feeling a little like I'm bursting with pride at some level, because when we did the work to learn about 7-way community mental health boards and then do the work to get it passed There was, obviously different opinions about it. So if I don't say this at the end of the night in about 20 minutes or so when we close up, I'm gonna say it now. Please tell and share. Talk about this, share it with people that you know. Let them know that percent of that bill that they receive, in my case, it's $15.96 a year for this work on my tax bill, is really well spent. And I'm just floored by the statistics, and especially Teresa, this idea that we had 64 children waiting for services and you have cut that down to 7. And that is that right there is part of the value, and what we can feel so proud of as a community that is scaffolding these supports. I'm going to open it up to questions from the room and or from our webinar, and I certainly have a couple myself that I could kick off with. Any questions or anything you want reinforced by any of our panel members or our folks who are leading our board? Yosh.
I think it's the.
Hang on 1 second, I'm going to have to use them.
This is primarily for Teresa. I think you said that you started with 2 social workers. I don't know if they were LCSWs. You went from 2 to 9, and that's an astounding growth. And I was just wondering how you achieved that. And I guess my second question is does anyone here actually provide training for LCSWs? I mean, that's something that I've got in the back of my head.
Yeah, I have to say that there's a lot of luck. I'm looking back, the fact that we were able to hire that many staff that quickly in this job environment, and especially a bilingual psychologist, is still, I don't know how we did it, but I think part of it is we have a strong reputation in the therapeutic community. We are a good place to work because we do a lot of mentoring and training, and I think that attracts staff to our organization. And I also think the fact that we are a nonprofit and that we don't turn kids away. There's a lot of people in the community who like that work and want to be part of it. So, a lot of different things, and truthfully, a lot of luck and a lot of good relationships. Therapists know other therapists. And so that's, I think, how we do that there. We are looking into actually internship programs for social workers and LCSWs. The last year has been focused primarily on growth, but that's our next step. We do a lot of training in occupational therapy, physical therapy, speech therapy, so we know we can do it here, and that's the next step we're going to take with our organization. So stay tuned.
If I can add, I mentioned it briefly, but one of the funded agencies is not here today, but that receive funding through this township award is Teen Parent Connection, and they are actually providing clinical supervision for interns with those dollars. So it is not the training itself, but the support for their being able to launch and get licensed. And that can be a very effective model because it is cost effective, but it's also critically necessary. And it's also the kind of training that we want young and emerging social workers and counselors to have, so they have the context for what's needed in the community.
I have a question, Kara, for you or Shannon, and that is for the 708 Community Mental Health Board. There's a specific requirement about what the grant money does, this idea of new programs, right? So can you speak to that for a minute?
I think the idea is we don't want to duplicate services, and so that's why the needs assessment is so important. That's why sort of doing an environmental scan to figure out what agencies are out there and what they do. And when we look at the applications, making sure that we're making decisions based on what we know is out there, what we know the gaps are. And so we're not duplicating services that maybe can be paid for otherwise.
Go ahead, Karen.
Do we need the mic? I don't know if I need it or not. We have a question from online. And the question goes, does Milton Township really have uniquely different mental health needs than Bloomingdale Township, Wild Township, or other townships? And this person asks that I am skeptical. So I'm thinking maybe are we specific to our needs that we need a 708 mental health, just for us.
I would say it's universal that every township has unmet mental health needs, unmet substance use disorder needs, and unmet needs for children and adults with disabilities. We share that in common. 708 Community Mental Health Board or Community Board is a pathway to trying to bridge some of those gaps. But I also want to speak to another component of that comment, which is to say, insofar as there are many agencies, Teresa's being one, others on the panel as well, that don't exclusively serve Milton Township, but inclusively serve Milton Township and many other places. So it is an opportunity as additional mental health boards come online for us to be thinking about how to collaborate effectively to ensure that we're not creating redundancies, use as much of our dollars for direct service and skew and administrative costs as possible. And that's really actually the opportunity. Because many of us are serving all of the county, and now we have 5 community mental health with 708 boards that have been approved, and so now it becomes the hard work of figuring out how we do our work better together.
Were there any other questions yet?
Not yet.
All right, thank you so much. Over here.
First of all, thank you very much for all that you're doing for our community, and I will echo Erica's comments. What I would like to know is, what are other things that you would like to be working on if you have these additional funds?
We'll open that up to anybody on the panel.
I would say expanding our services. So we're looking to do more groups, to kind of bridge the gap from our waiting list. So if they can't get in for individual services, maybe they can use the groups to supplement. Also, expanding our space, because the need is growing. So being able to provide more space for our clients in a safe environment.
I'll just share that, this grant for the Y is specific to preteen. And we were fortunate to get a DuPage Foundation grant for a teen mental health initiative in partnership with the Life Center in Naperville. So we feel that there will be a growing need for mental health support for teens as we see more interaction, more programming. I think I said earlier about a big component of youth mental health is that sense of belonging. And do they have that support system if they're not getting it at home? And that's definitely a place where we find that we can have a niche. Why isn't going to be everything to everyone, but if there's different aspects that we can provide support. So I think that for us long term, it's not only filling the gap of the out of school time, but then we think there's a niche for teens that there will be a need.
I have kind of a follow-up question, and this is both for Clark and Jessica, and that is you're working closely via the grants that you wrote and then got funding for with the school districts in Glen, Ellyn, and on a personal level, I know that the social workers and professional psychologists in the school districts are exceptional. A lot of their work is involved with IEPs, individual education plans, 504s. So what are you doing to help support, or where do you see yourselves coming in to help to support some of those needs that might not be able to be met by social workers on a day-to-day basis because by law they're required to provide minutes to specifically those needs, but the mental health supports, issues around anxiety, those kind of things that we've seen, increased. How do you see that supporting the work that you're doing now, being able to take some of that on?
So Jessica mentioned earlier, so one day a week I go into Glen South High School and I meet with the kids one-on-one. So we do therapy in their actual school in their free periods. So it allows me to support the staff there at school and provide that additional support to the student that maybe can't see the counselor as often as they would like to because they're supporting other students with IEPs and 504s. And we're hoping to expand that to other schools as well. So West in the middle school to continue to help them as well.
And I would just say that, our staff already have a strong relationship with the school social worker and that communication that's already in place in regards to behaviors that are going from the school day to the out of school time has been, one form of keeping the social worker up to speed on how a child's behavior and how they're doing in that after school time. With the addition of the social worker, we really feel that it will take a lot of the existing social workers caseload and to still be able to carry through on that IEP plan or other plans that that child has in place.
Yeah, I think that's just a really important kind of reminder because I think that sometimes there's that assumption that in the school day, the children are getting some of these needs met. And in fact, there's just structures in place, requirements in place, laws in place where it doesn't happen. Teresa, you talked about working with school districts in early childhood. We're familiar here with the Glen Early Childhood Collaborative after case. What specifically does Eastern Seals do in terms of reaching out or working to educate parents of your services, but also where there may be some local services for early childhood?
Yeah, so the primary way in which we support the early childhood programs is through the screening programs, and those are for the collabs for kids who may not be already identified by the school district. And then it's just really kind of going out in the community, doing things like this, hopefully educating all of you, hopefully go home and take the screening for a child, so that's really the most important way. And then working with the early intervention system, that's where we play a big role as well. That answers your question.
Yeah, thank you. Are there any other questions in the room? I have one other one. I'm going to put here on the spot here. Literally this week, I think it was in the Daily Herald, there was an article and you were quoted in it around Medicaid issues. And can you just speak to that again from the perspective of how important it is to kind of saturate this information because of the challenge of getting people to understand the process that's involved. And we're coming off of, again, funding starting to be changed, right? As the pandemic is moving into, new time.
Sure. So folks have probably heard about the public health emergency unwinding and the fact that after many years of essential supports, including continuous Medicaid enrollment, we are now coming to the point in April of requiring people once again to document their eligibility for Medicaid. That's not a bad thing. It's appropriate that people would redocument their eligibility for a program that uses a lot of tax dollars. The problem is that if people haven't been required to do that for 4 years and have moved in the last 4 years, first, they may not even get the letter. And if they get the letter, they may not have experience with knowing how to navigate that system. And so I would imagine everyone is in this panel, because certainly everyone with whom I talk every day is acutely sensitive to the fact that we are about to have 100% of our current Medicaid enrollees and 160,000 Medicaid enrollees in DuPage County having to re-qualify. Statistics tell us that as many as 1/3 of those individuals who are asked to re-qualify will lose coverage for a period of time, not because they aren't eligible, but because they can't navigate that process. And that has consequences that are severe for those families. You don't want to find out you don't have coverage when you show up in the emergency room. But it also has consequences for everyone at the table who Medicaid may not pay the full cost of their care, but it's certainly a piece of that puzzle. So all of us are really working together on trying to make certain that families understand the process, that they have the assistance that they've updated their addresses in the system. That's the first and most simple piece. And then that we do everything that we can to ensure that everybody who does still qualify for Medicaid, because most will, is able to stay enrolled continuously. It's a big, mammoth, challenging task. And the state of Illinois and the state HFS offices are struggling with the same staffing challenges that everyone else has. So just when they're asked to eat an elephant, they find themselves without a fork and spoon.
Very good.
Good analogy. Question?
Can you guys comment on how many will that you care for in your agencies that are homeless, especially among your student populations?
As of right now that I know of, none of our clients are homeless, but we are partnered with bridge communities that helps with that transitional housing. So they're coming from being unhoused into working with bridge communities to become more stable.
And at this point, we don't track that number, but we do have referrals from both paths and bridge communities for families that need support and services, whether it's for childcare or other types of program assistance.
And that's the same for us. We don't currently track that, but we do referrals and suspect and we know that we have several families who are homeless or in transitional housing.
It's a true statement that all of our homeless services providers in DuPage County are experiencing unprecedented numbers of individuals. And most remarkably, it isn't just that they're serving more individuals, they're serving more families with children. A part of that is because frankly, COVID changed the way that homeless services were provided, and it's largely positive, going from really well-intended and wonderful church-based congregate living to hotels, creating more safety for a family who didn't have a place to stay, to know that they could come and have a room to stay in that was clean and safe for their little ones. But it also means that they are really struggling. And there's also 7, 12, 47 different definitions of homelessness. The US government has a definition for literal homelessness that confers certain services, but there are also a host of families who are housing unstable, who are doubling up or tripling up to be able to make things work. And this is an expensive place to live. And housing costs are extremely high here if your income is limited. If you look at the impact of age data, you'll see that we have unusually high numbers of individuals who report not just housing instability, but extreme housing unaffordability. We are not just 30% of their take-home dollars are being spent on housing, but more than 50%. Because there aren't very many apartments and they're expensive.
I just can't hold myself back, but to put in a plug that certainly there are communities, Glen Ellyn being one of those, that is looking at issues around affordable and sustainable housing. And it is such an important conversation to have because it speaks to exactly what all of you are looking to address, with your families. And
thank you for everything you're doing. I'm always interested when I attend a presentation like this to know what we can do as individuals or as a community to help support the work you're doing.
Well, not to be repetitive, but have everyone take the early childhood screening, because the earlier you can impact a child's brain during those critical growth times, the less issues we will have as a society as a, whether that's mental health, whether that's disability, whether that's juvenile delinquency, all of those things play in. The more impact we can have in a variety of ways, and I'm not just talking about children with disabilities, all children in those early critical years have significant positive impact on the future for those children if we are address those concerns early.
I would just say that be an advocate, be aware of what organizations are doing in the community, and help spread that work. So I think there's so many organizations that do great work that people just are not aware of the impact that they have.
I would say too, similar to what Rob said, be an advocate. I know, there's opinions on both sides, these are tax dollars, and so, all of these agencies I mentioned, and I run an agency myself, and every day we're putting together a puzzle for how we're supposed to fund all of these services, right, that people need, and so there's not just one or two entities that fund those services or support those services, you have to look and look and look. And it's state, it's federal, it's county, it's private money, it's township money, community mental health board money, so we're a piece of that puzzle, we're not the only piece of the puzzle, we're a very important piece of the puzzle. And so be an advocate for that.
I would say normalize behavioral health services, destigmatize behavioral health. Get us to a place where we can talk about depression in the same way that we talk about the flu or we talk about GI symptoms. It should be the same and it still isn't. And that's the most powerful, profound thing that we can do. Part of that is also educating ourselves. So look for mental health first aid, become a more sensitive observer of how other people are doing. Ask them and offer them support and comfort. Because that's how we'll get to a different place.
Thank you. The time, the years of service, the commitment on this panel of your entire career is encapsulated in the work that you're doing and the people that we don't see, the kids, the teens, the infants, the families who are those shadows behind you of all the work that you're doing. So on behalf of our community, thank you so much. And I'll turn it back over to Gregory.
Well, that was great. Thank you all. Thank you, Erica, for leading the discussion. And thank all of you panelists for being here and for all the work that you and your agencies do to support behavioral health in our community. So thank you very much. I do want to wrap it up with some announcements. Let's see here. We invite everyone to join us at Kennedy Park on Wednesday, April 12th, for an environment-focused civic awareness series program with that catchy title, Plastics Pollution and Community Solutions. It's an expert panel that will be moderated by the Daily Herald's Jenny Whitten. It will look at plastic from every angle, including why we should care, how to reduce and use, and potential Illinois legislation to address plastic pollution. April 4th is election day, so we want every eligible voter to vote. Please be sure to vote in the consolidated election. Early voting has already begun. And voter services, Run League has put together this fabulous handout. There's a bunch in the back. We want everyone to take at least one vote. It has great information about in the states where you can and polling places where you can vote. So please take one, take two, take three, pass it out to somebody else who needs that information. And be sure to check our website for more information to find recordings of candidate forums. So our voter services has held candidate forums for the local school board elections and the COD board. So please take a look at those. Be prepared when you vote. On our website, you can also get further information on upcoming programs that we're hosting and find recordings of our previous community programs, such like this one. And what is that? Oh, there's a very long in the back. And of course, our website's full of great information. Check it out if you're interested in joining us in our mission to defend democracy and empower others. I wish everyone a good night. Thank you all who took time to come out here for the program and are watching it at home. Again, we wish everyone a great night. Thank you.